Bismillahirrahmanirrahim. In the name of Allah, who is the most beneficent and the most merciful. Today, the thought of the day is character cannot be developed in ease and quiet, only through experience and trial. In suffering can the soul be strengthened, vision cleared, ambition inspired, and success achieved. My name is Dr. Inshrah. I am a PGR of Community Medicine and Public Health at King Edward Medical University, Lahore. Today, the topic of my presentation is dog bite, rabies, and I'm presenting this under the kind supervision of Professor Dr. Saira Afzal. Learning outlines include dog bite, introduction, epidemiology, transmission, and pathogenesis, stages of rabies and symptoms, investigations, management, immunization and prevention of rabies, recent updates, and MCQs. Learning objectives. At the end of this presentation, the participants will be able to describe rabies and its spread, differentiate between its types, sketch an investigation plan for rabies, demonstrate the management of a rabies patient, comply to the international practice of rabies prophylaxis, recognize the global importance of its eradication. This is an overview of rabies. Introduction. Dog bite or rabies, also known as hydrophobia, is an acute, highly fatal viral disease of the central nervous system. It is caused by Lyssa virus type 1 of the Rhabdoviridie family. It is primarily a zoonotic disease of warm-blooded animals, particularly carnivores, such as dogs, bats, cats, jackals, wolves, etc. It is transmitted to man usually by bites or licks of rabid animals. It is the only communicable disease of man that is always fatal. Epidemiology. Rabies is an enzootic and epizootic disease of worldwide importance. It occurs in more than 150 countries and territories and possesses a potential threat to more than 3.3 billion people. Rabies in dogs is the source of 99% of human infection. It is most common in children aged less than 15 years and majority of these being males. Globally, more than 15 million people receive rabies prophylaxis each year. Still, human deaths by rabies is estimated to be 59,000 annually, with 95% of cases occurring in Asia and Africa. Causative agent is Lyssa virus type 1 from the Rhabdoviridie family. It is a bullet-shaped neurotropic RNA-containing virus with two types of antigen, a glycoprotein G protein antigen from the virus membrane and an internal nucleoprotein antigen. The glycoprotein seems to be the only antigen capable of inducing the formation of virus-neutralizing antibodies. There are two types of rabies virus, street virus and fixed virus. Here are the general characteristics of both of these types of viruses. Street virus, freshly isolated, produce negri bodies, affects salivary glands, pathogenic, and incubation period is 1 to 3 months. This also produces disease. Fixed virus is isolated after serial intracerebral passage in rabbits or cell lines, do not produce negri bodies, do not affect salivary glands, not pathogenic, incubation period is 4 to 6 days, used for vaccine. Transmission, source of infection is saliva of rabid animals. Mode of transmission is mostly by deep bite, scratch, or direct contact of saliva from the infected animal with human mucosa or fresh skin wounds. Rarely by inhalation of virus-containing aerosols or via transplantation of an infected organ. Human-to-human transmission by bite is theoretically possible but has never been confirmed. High-risk groups are laboratory staff workers with rabies virus, veterinarians, dog handlers, hunters, and field naturalists. Incubation period is 1 to 3 months following exposure, but vary from 7 days to many years. Pathogenesis involves 6 steps from entry of virus into the system to invasion of different structures. Penetration through skin after animal bite, replication in muscles and connective tissue cells, entry into the peripheral nerves, ascent from spinal cord to brain, encephalitis, and then invasion of muscles, glands, and even skin. Stages of rabies. There are 5 major stages when an individual develops rabies. Incubation period from 30 to 90 days, but it may be variable. Prodrome, 2 to 10 days. Acute neurological stage, 2 to 10 days, and eventually death. These are the symptoms of rabies. These are initial symptoms that occur during the prodromal stage, and these are the rabies-specific symptoms that occur in acute neurological stage. There are 2 types of rabies, furious or encephalitic rabies that occurs in 80% of the cases, dumb or paralytic rabies that occurs in 20% of the cases. And here are the prominent symptoms of both these types of rabies. Laboratory investigations. Investigating a rabies patient involves following tests: direct fluorescent antibody test, that is the gold standard, tissue for at least 2 locations in brain, preferably the brainstem and cerebellum, CSF analysis, saliva, serum, and urine test, skin biopsy, corneal smear, MRI, brain, and EEG. Management of rabies. Case management of rabies includes the following points: general management, wound care, immunization and dog observation. General management. Isolation in quiet room, away from the external stimuli such as bright light, noise, or cold draughts. Sedatives and analgesics, antispasmodics, excessive hydration and diuresis, respiratory and cardiac support. Wound care. Flushing and washing the wounds, scratches, and adjoining area with plenty of soap and water under a running tap for at least 15 minutes. Irrigation with virucidal agents, either alcohol, tincture, or 0.1% aqueous solution of iodine or povidone iodine. Suturing if necessary, but only after 24 to 48 hours, applying minimum possible stitches. Antibiotics and anti-tetanus measures. Immunization. Combined administration of a single dose of rabies immunoglobulin that gives passive immunity and a course of vaccines that gives active immunity. Dog observation. Try to detain the dog for a 10 days observation if possible. Observe its behavior and see if it remains healthy for the observed period. If your dog is still alive, even after the observation, it was not shedding rabies virus at the time the bite occurred. Rabies vaccine. Rabies vaccines are of the following two types: cell culture vaccine, CCV, embryonated egg-based vaccine, EEV. Both of these vaccines are free of any preservatives with shelf life of greater than 3 years, provided they are stored at 2 to 8 degrees Celsius and protected from sunlight. After penetration, the vaccine should be used within 6 to 8 hours if kept at the correct temperature. This is the vaccination schedule before exposure and then after exposure. Rabies immunoglobulin. There are two types of rabies immunoglobulin. Human rabies immunoglobulin that is given 20 international units per kilogram of the body weight. Equine rabies immunoglobulin that is given 40 international units per kilogram body weight. Rabies immunoglobulin for passive immunity is administered only once, preferably at or as soon as possible after the initiation of post-exposure vaccination. Not indicated in pre or re-exposure cases. Immunoglobulin is injected into or around the wound site. The remaining, if any, is injected intramuscularly away from the site of vaccination. These are the two types of rabies immunoglobulins. Prevention of rabies. Prevention of rabies involves general preventive measures, vaccinating dogs, vaccinating people, and awareness campaigns. General preventive measures. Nursing personnel attending rabies patients should be warned against possible risk of contamination. They should wear face masks, gloves, goggles, and aprons, as virus may be present in patients' body fluids. Persons having bruises, cuts, or open wounds should not be entrusted to look after such patients. Vaccinating dogs. 80 to 90% of the dog population is accessible for vaccination. Vaccinating dogs through mass vaccination programs is the most effective strategy for preventing rabies because it stops the transmission at its source. All dogs should receive primary immunization at the age of 3 to 4 months, and booster doses should be given at regular intervals. Culling free roaming dogs is not effective in controlling rabies. Vaccinating people. Exposure prophylaxis by the use of vaccines may be considered under 3 heads: post-exposure prophylaxis, pre-exposure prophylaxis, post-exposure treatment of persons who have been vaccinated previously. This is post-exposure prophylaxis. Here are the 3 categories, and this is the intervention. First category, when there is only touching or feeding animals, licks on intact skin. No intervention required. Second category, when there is nibbling of uncovered skin, minor scratches or abrasions without bleeding. Immediate vaccination and local treatment of the wounds. And third category, when there is single or multiple transdermal bites or scratches, licks on broken skin, contamination of mucous membrane with saliva from licks or contacts with bat, then immediate vaccination, administration of rabies immunoglobulin, and local treatment of the wounds. Intramuscular administrations of vaccines. A single dose of 0.5 ml or 1 ml, depending upon the type of vaccine, into deltoid or anterolateral aspect of thigh. There are 2 regimens. SN regimen, which has 5 doses, 1 dose on day 0, 3, 7, 14, and 28. Zerab regimen, 4 doses, 2 doses on day 0, followed by 1 dose on day 7 and 21. Intradermal administration, a single dose of 0.1 ml per site at 2 sites in deltoid or anterolateral aspect of thigh. 8 doses in total, 2 doses on day 0, 3, 7, and then 28. 1 intradermal dose equals 1/5 of intramuscular dose. Pre-exposure prophylaxis. Pre-exposure prophylaxis is for individuals, but mostly recommended for those who are at continual, frequent, or increased risk of exposure to rabies virus. These include laboratory workers dealing with rabies virus, veterinarians and animal handlers, travelers with outdoor exposure, and children living in rural high-risk areas. 0.5 ml or 1 ml of intramuscular administration, or 0.1 ml of intradermal administration of vaccine. 3 doses in total on days 0, 7, and then either 21 or 28. Booster doses are administered as extra precaution only for people who are at continual high risk of exposure. If available, antibody monitoring is preferred to booster administration. This is done every 6 months. A booster dose is given only if rabies virus neutralizing antibody titers falls to less than 0.5 international units per milliliter. Low-risk individuals have serological monitoring every 2 years. Post-exposure treatment of persons who have been vaccinated previously. Rabies virus exposed individuals with documented previously completed vaccination have 2 options. 1 intramuscular or intradermal dose on day 3 and 0. 4 intradermal doses equally distributed over left and right deltoids and thigh at day 0. These regimes apply to people vaccinated against rabies who have demonstrated rabies virus neutralizing antibody titers of 0.5 greater than 0.5 international units per milliliter. Rabies immunoglobulin is not indicated in these cases. These are the re-exposure rabies treatments. There are 3 categories. If it has been less than 15 days to your last vaccine and the schedule is incomplete, then no further vaccine is required. If the schedule was incomplete, indicate vaccine doses needed to complete the schedule. If it has been 15 to 90 days and the schedule was complete, no vaccination required. If it was incomplete and only 1 to 2 doses were given, then indicate 4 vaccine doses on days 0, 3, 7, and 28. If it was incomplete and 3 to 4 doses were already given, then indicate 2 doses on day 0 and 3. And third category, if there has been more than 90 days to last vaccination and the schedule was complete, indicate 2 vaccine doses on day 0 and 3. And if it was incomplete, then indicate complete schedule. Contraindications to vaccination. For pre-exposure prophylaxis, previous severe reaction to any component of vaccine. For post-exposure prophylaxis, no contraindications as severely fatal disease. No contraindication for infancy, pregnancy, immunocompromised individuals, including children with HIV/AIDS. Awareness campaigns. Public education for both children and adults on dog behavior and bite prevention. What to do if bitten or scratched by a potentially rabid animal. Responsible pet ownership are essential extension of rabies vaccination programs. Globally, Rabies Day is celebrated on 28th of September every year. WHO facts, rabies is a serious public health problem in over 150 countries and territories, mainly in Asia and Africa. It is a viral, zoonotic, neglected tropical disease that causes tens of thousands of deaths annually, with 40% of being children under 15. Dog bites and scratches cause 99% of human rabies cases. Once the virus infects the central nervous system and clinical symptoms appear, rabies is fatal in 100% of cases. However, rabies deaths are preventable with prompt post-exposure prophylaxis. Post-exposure prophylaxis consists of thorough wound washing, administration of a course of human rabies vaccine, and when indicated, rabies immunoglobulin. If person is bitten or scratched by potentially rabid animal, they should immediately and always seek PEP care. WHO and its global partners aim to end human death from dog-mediated rabies through a comprehensive One Health approach promoting mass dog vaccination, ensuring access to post-exposure prophylaxis, health worker training, improved surveillance, and bite prevention from community awareness. This is a WHO campaign, 0 by 2030 against rabies. Recent updates. Burden of dog bite injuries and wound management practices to prevent rabies among dog owners. Background, the study aimed to estimate the burden of dog bites among dog owners and their wound management practices to prevent rabies. Materials and methods. A cross-sectional study was conducted among pet dog owners in a high-end housing society of National Capital Region of Delhi. A pre-tested and pre-validated schedule was used to collect data by consecutive sampling through community survey. Results, a total of 100 families were studied, which covered 355 family members. The incidence of dog bites in the past 1 year was found to be 44 out of 355. Pet dogs were responsible for 31 out of 44 bites. Among 44 dog bite incidents, 30 reported taking any injection after the incident and 10 reported receiving anti-rabies vaccine. Conclusion, the incidence of dog bite among dog owners was high. The rabies pre- and post-exposure prophylaxis practices adopted by the participants were found to be inadequate. Review of psychological effect of dog bite in children. Dog attacks not only cause physical injuries, but can also lead to long-term psychological problems. A review was performed to investigate the scope of literature on the psychological effect of dog bites on pediatric population. A literature search was performed on Web of Knowledge database between 1982 to June 2023, returning 249 results. 14 primary studies were classified as eligible, and 9 further studies were added from prior knowledge and bibliographical searches. The most common psychological consequences of dog bites in children were post-traumatic stress disorder, dog phobia, nightmares, symptoms of anxiety, and avoidance behavior. Studies on dog bites in a pediatric population with a specific focus on the psychological consequences associated with dog bite and their management are sparse. Future research and practice should more greatly consider the psychological impact on a child victim of dog bites and their family members, as well as their management to avoid the development of mental health issues and improve their quality of life. Gavi to boost access to life-saving human rabies vaccine in over 50 countries. Gavi, the Vaccine Alliance, in collaboration with partners, is announcing support for human rabies vaccine for post-exposure prophylaxis as part of routine immunization. Eligible countries are receiving guidance on how to access these vaccines under Gavi co-financing policy. The first round of application will be accepted by mid-July 2024. This development complements ongoing global efforts of Zero by 30, led by the United Against Rabies partners. In more than 150 countries where dog rabies remain a serious public health problem, stocks of human rabies vaccine in public health systems are often extremely limited, especially in marginalized communities where human rabies vaccine is available through private facilities. The cost of post-exposure prophylaxis can impose a catastrophic financial burden on families and communities. Gavi's aim with this program is to contribute to global rabies efforts and save lives by helping countries ensure that human rabies vaccine are available to anyone who needs them, and that vulnerable and marginalized communities have equal access to these essential medicines. Multiple choice questions. A 12-year-old boy presented to ER of Mayo Hospital with a history of dog bite by a rabid animal. It is suspected to be a case of rabies. All of the following are involved in the transmission of rabies except A, bats, B, cats, C, dog, D, rats, and E, wolves.
E, wolves.
B, cats.
The correct answer is D, rats. A stray dog is seen often in the close vicinity of a housing society in Lahore. Individuals, especially children, should be warned against it as dog causes 99% of rabies cases in human. Which of the following is not a mode of transmission of the rabies virus from dog to human? A, bite, B, lick, C, look, D, slightly contact with mucosa, and E, scratch.
Look.
The correct answer is C, look. An extremely fatal viral disease, rabies, is caused by rabies virus. The virus has two main types, one of which is fixed rabies virus. Which of the following best describes this type of virus? A, natural, B, negri body, C, pathogenic, D, salivary transmission, or E, vaccine preparation?
B, negri body. Vaccine.
Correct answer is E, vaccine preparation. A 30-year-old hunter was bitten by a dog 3 weeks ago in the outskirts of Lahore. He is currently isolated in a room and shows signs of hydrophobia, photophobia, and phonophobia. He is at which stage of rabies? A, acute neurological, B, coma, C, incubation, D, prodrome, or E, recovery?
A.
Yes, the correct answer is A, acute neurological. A suspected case of rabies presents in a hospital. There is a history of dog bite 1 week back, but no signs and symptoms have appeared. Which one of the following investigations is most accurate for the diagnosis of rabies? A, corneal smear, B, direct fluorescent antibody testing, C, MRI brain, D, skin biopsy, or E, urine test?
B.
Yes, the correct answer is B, direct fluorescent antibody testing. A young guy was jogging in a park as a part of his routine exercise. He was suddenly encountered by a stray dog. The dog showed aggressive behavior and started running after him. He was eventually caught by the dog and received multiple lacerations on his leg. What should be the guy's first step? A, apply a band-aid and continue with his exercise. B, chase the dog to take revenge. C, immediately wash the wound with excessive water and soap. D, search for the dog owner and ask him to put a leash on his dog. E, visit a hospital for vaccination.
C.
Yes, the correct answer is C, immediately wash the wound with excessive water and soap. A suspected case of rabies is admitted in the Mayo Hospital after giving history of dog bite. The patient is kept in isolation and treated accordingly. All of the following measures are necessary for general prevention of rabies except A, anti-rabies vaccine should be administered to the suspects. B, dog vaccination programs by the state. C, health professionals should take precautionary measures when dealing with suspects. D, public should be educated about rabies by awareness campaigns. Or E, stray dogs should be killed. Yes, the correct answer is E, stray dogs should be killed. A rabies vaccine was prepared in morning in a tertiary care hospital of Punjab, but it was neither used nor discarded and kept on the vaccinator's desk. A 9-year-old boy arrived at 4 p.m. for vaccination after being bitten by a rabid dog half an hour ago and was mistakenly injected with this very same vaccine. Later, he developed symptoms of rabies because A, boy's immune system did not respond to the vaccine as expected. B, faulty technique of administration was used. C, rabies vaccine does not work for children. D, vaccine was non-viable due to temperature change. Or E, vaccine was outdated and no longer effective. The correct answer is D, vaccine was non-viable due to temperature change. A hawker standing by the roadside was bitten by a dog. This is his third time in a span of 2 years. After providing the first aid, he was taken to the hospital. He was administered 1 dose of vaccine, but no immunoglobulin. This is because A, already vaccinated individuals do not need immunoglobulins. B, immunoglobulin has no role in rabies. C, limited stock was available in the hospital. D, only severe cases of rabies was given immunoglobulin. Or E, WHO has banned the use of rabies immunoglobulin.
A.
Yes, the correct answer is A. Already vaccinated individuals do not need immunoglobulin. A newly practicing veterinarian was undergoing pre-exposure prophylaxis vaccine course of rabies. He had completed his schedule 30 days after the last vaccine. He was scratched by a dog at his clinic. What should he do? A, full post-exposure prophylaxis course is required. B, no intervention as he is already immune to disease. C, seek medical help immediately. D, 2 doses should be administered on day 0 and 3. Or E, wait for the dog's observation period to complete.
E. B.
The correct answer is B, no intervention as he is already immune to disease. These are the correct answers of all MCQs. This is the link of our YouTube channel. Kindly like and subscribe. Thank you for your attention.
Assalamu alaikum. Dr. Inshrah, you will present the topic quite well and in elaborated way. All the components related to rabies are covered. There are few suggestions from my side. Prevention of rabies present under the headings of 3 levels of prevention. And the level of prevention are primordial, primary, and then secondary prevention, and then tertiary prevention. Otherwise, all presentation are very well prepared, and especially the MCQ part. All MCQs are C3 level, and they are very good and concept based. Thank you very much.
Thank you, Dr. Naila.